Meanwhile, India has reported over 750 new cases of COVID-19 in the past week. Kerala, Maharashtra and Delhi have seen the highest surge in number of active COVID cases, taking the country's total active infection caseload to 1,009. As for the latest data that has been released, Kerala has reported the highest number of cases in the country, reporting 430 active cases of infection. 7 deaths have been reported due to COVID infection, with 4 cases of deaths coming from Maharashtra, 2 from Kerala and 1 in Karnataka. Meanwhile, Delhi has reported over 99 cases in the past week, bringing the tally up to 104. Delhi Chief Minister Rekha Gupta has said that the government and hospitals are prepared and that there is no reason for people to panic. Amid the rising cases of COVID-19 infections across India, 2 new variants have been discovered called the NB181 and the LF7. The World Health Organization has classified both these variants under monitoring right now. Before we move on to our guests, I want to quickly bring in our reporters on the ground. Raj Karan joins me from the south, Anand Singh with us as well, Belly Thomas joins me from Bengaluru. Let me start with Raj. Raj, can you take our viewers through the details of what really is the situation like in Kerala and what are some of the other states around also announcing at this point in time?
Yes, Devika, in over 400 cases has been tested positive in Kerala state, and when we see at the Tamil Nadu, 69 cases have been got there in Tamil Nadu, and when we comes to the Andhra Pradesh, only 4 cases has been reported till now. 2 is from Kadapa and 2 is from Vijayanagaram. These 4 cases has been reported 5 days back, but now the authorities, when we spoke to the DMHO, Director Medical Health Officers, they said that their health condition is presently stable now. They are undergoing in a quarantine. They are home quarantine, and 2 of them are in a hospital. When we see at the Telangana has reported only 1 case till now. Every day the test in a government hospitals is continuously going on. But however, we have seen only 1 case in Telangana. That too, he is a pulmonology doctor. He is from outside, near to Medchal district. So he was reported positive a few days back. Now, at present, only we can see only 1 case in Telangana, whereas we have seen the highest cases in Kerala. The government has taken all the measures. When we spoke to the Kerala Health Department, they said that they are prepared with each and everything. They got the separate health checkups for the positive patients, and all the arrangements has been made at the hospitals. Oxygen is available, and the PPE kits are available. Everything is till now, everything is fine now. There is no need to panic. Even we have seen in south the government says that there no need to panic for anything. All the arrangements has been done and all the things are on stable. So no need to panic for this. Devika.
Okay, Raj, what exactly are the advisories then that have been issued?
Yes, we can see the advisories when we talk about the Andhra Pradesh and Telangana. The both states have given an advisory 2 days back, whereas they requested the citizen not to go in a public places, avoid the mass places, and mandatory of mask has been given. In that advisory, mandatory of mask has been given, and whenever you go out, when you come back to your house, so please wash the hands with the sanitizer. These are the advisory given by the both the Telugu-speaking states, and also we have heard that all the parties, the rallies has been cancelled by both the governments. If they wanted to take any party rallies, so they are cancelled now.
Okay, Raj, stay on with us. Anand Singh also joins me on the broadcast. Anand, what really is the situation like in Delhi and the rest of North India, and what are the advisories that have been issued?
Yeah, look, the way in which the number of COVID cases in the national capital and Delhi NCR region has crossed 104 marks. So clearly, Delhi has issued advisory and has asked all the hospitals over here to remain prepared with the maximum isolation wards and proper beds for the patients having symptoms of COVID. And similarly, they have also asked all the hospitals to be ready with the oxygen supply properly, so that there is no dearth or no shortage of oxygen when is required. So clearly, Delhi government has issued this advisory in the wake of 104 active cases that has gone up in the Delhi NCR. And so all the hospitals have been asked to be on the forefront to deal with this situation. However, Delhi's Chief Minister Rekha Gupta also said that she has been monitoring the cases of COVID in the city. Meanwhile, Delhi Health Minister Pankaj Singh also assured that the symptoms this time of COVID are only related to cold and cough, which are like just viral fevers, and none of them have some serious effects on it. So clearly, the Delhi government has taken up the task to prepare all the hospitals in wake of the number of COVID cases going up. But even as they are preparing and has asked all the hospitals to remain alert to look at the way in which the cases are having some surge in the last few weeks. So similarly, in several of the northern states of India, similar guidelines have been issued to hospitals to remain alert and to monitor such patients who have tested positive for the COVID so that they can be isolated and the spread can be stopped. So these are the things that all the state governments here in North India are taking, and they are taking all the precautionary measures to stop the surge. Back to you, Devi.
Okay, Anand, stay on with me. Belly Thomas also with us on the broadcast. Belly, take our viewers through the details of what really is being reported as far as Bengaluru in Karnataka are concerned.
Devika, a total number of 47 people have been tested positive for COVID in Karnataka, and in that around 32 have been from Bengaluru. Around 3 infants have been tested positive, and the Karnataka has recorded the first death of a COVID infection, which is a 85-year-old person who succumbed with a multi-organ failure and breathing difficulties at a Whitefield area in Bengaluru. And the government as such has issued advisories stating that the members of the public should be following the COVID appropriate behavior. And though the masks have not been mandatory so far, the testings have been, the number of testings at each hospitals have been increased. Each hospital has been directed to stock at least 5,000 RT-PCR kits so that, people with symptoms such as respiratory distress or SARI-like symptoms like severe acute respiratory illness-like symptoms are there. They are, appealed. They are requested to undergo testing as of now. So there are quite a few people who walk in for these tests for COVID, but they don't have symptoms as of now. According to the COVID Genomics Consortium, there are 2 variants that have been identified as a new this one, which is NB.1.8.1 and LF. 0.7. So these 2 variants, which are not so much aggressive, is what the sources from the health department say. So the cold, the symptoms of cold and cough is just that is what they get, and they have been asked to actually follow COVID appropriate behavior, and there is no need to panic, is what the government authorities so far conclude with, Devika.
Okay. Before we move on to our guests, one last word in from Shahid Ansari. Shahid, quickly take our viewers through what is it that's the situation in Maharashtra right now.
देखिए, जो रिसेंटली अपडेट आई है स्वास्थ्य विभाग की तरफ से, उसमें जो है 43 केसेस है पूरे महाराष्ट्र में, जबकि मुंबई में ये 35 केसेस जो है रिकॉर्ड किए गए हैं। तो कुल मिला के जो है जनवरी, फरवरी, मार्च और अप्रैल ये सब को छोड़ दें तो यहाँ पे जो भी केसेस आए थे वो बहुत नाम के केस थे। 6 हर महीने 6 या 7 केसेस थे, लेकिन मई में अचानक इस केस में जो है बढ़ोतरी देखने को मिली, जिसके बाद प्रशासन ने जो है मुंबई के कई इलाकों में, अगर हम सरकारी हॉस्पिटल की बात करें, बीएमसी हॉस्पिटल की बात करें, तो देखिए हर हॉस्पिटल में जो है आइसोलेशन वार्ड कायम किए गए हैं। हालांकि ऐसे मोमेंट पर जब कोविड की लहर ज़्यादा है या उसकी चपेट में जब लोग ज़्यादा आते हैं तो उस वार्ड को जो है पूरी तरह से एक्टिव कर दिया जाता है। जबकि अगर बात करें, हमने आज मुंबई के जे हॉस्पिटल के डीन से बात की तो उन्होंने बताया है कि उनके भी हॉस्पिटल में जो है आइसोलेशन वार्ड जो है बना दिया गया है, जिसमें 15 बेड है। और वो इसलिए कि अभी तक जो है कोई ऐसे केसेस जो है, जो भी केसेस हैं इतने ज्यादा नहीं है कि वो यहाँ आए जे हॉस्पिटल में, लेकिन फिर भी हमने वार्ड को एक्टिव किया है। उन्होंने दूसरी बात ये भी कही है कि इसमें घबराने जैसी कोई बात नहीं है, जो भी है घरेलू उपचार से भी हो सकता है, लेकिन अगर कोविड के सिम्टम उन्हें नजर आए तो उसके लिए वो स्थानीय हॉस्पिटल या अपने डॉक्टर से उसके लिए जरूर राय मशवरे लें, क्योंकि अगर आप किसी भी चीज को, किसी भी बीमारी को हल्के में लेते हैं तो बाद में वो संगीन नतीजों का सामना करना पड़ सकता है। इसलिए
understood. Okay, on that note, I thank all of our reporters for joining us on the broadcast. We also have with us Dr. Sanjeev Bagai, with me Dr. Swati Maheshwari and Dr. D.K. Gupta joining us on the broadcast. Let me begin with Dr. Bagai. Dr. Bagai, your advice at this point in time, sir, to viewers who are watching and people who are now reading about a surge in some COVID cases, your advice to them, sir.
Good evening everyone. So it's a clear word of caution, but very definitely no panic, no anxiety, no worry. To put it in a medical context, these are all sub-break lineages, what we call as sub-lineages or sub-variants of the parent BA2.86, which has then come into convergent mutations. That means various mutations come together, some deletions, some additions, and it forms the next major chain, which was called as JN.1. JN.1 then became XDV, and XDV has now become LP 8.11 and so on. These are just names given to a broader group known as Omicron. In terms of a clinical picture, these variants are highly transmissible. They are called as the fittest variants amongst all the COVID variants. And let me tell you, in just Omicron, there are more than 1,800 subvariants which have been isolated on the genomic testing. They are the fittest, but they are not that infective. So it's a trade-off. They have gained approximately 19 unique mutations, but they have lost 24 past mutations. So they can go from person to person very quickly. That means it can transmit and spread very quickly, but it is less lethal, less infective. A word of caution here is that it is the most immune invasive variant group. That means your past natural infection will no longer give you immunity in terms of herd immunity for these subvariants. And the second is the previous vaccines which have been given, although they give you cross-reactive immunity, will not be as effective at the present moment. So the simple precautions: be careful of close, clustered, crowded places, poorly ventilated places. If you're stepping out, especially with comorbidities, if you have pre-existing illnesses, if you, especially diabetes, hypertension, heart, liver, kidney disease, please wear a mask. If there is any fever, simple precaution is isolate yourself at home for 3 to 5 days, consult your doctor, don't take unnecessary medication apart from paracetamol, no antibiotics, test in time but after consulting with your doctor. If you are coming in contact with anyone who has cold, cough, keep a safe distance and immediately inform your doctor if you have any symptoms which include fever, headache, nausea, vomiting, rash, cold cough, sore throats, runny eyes, and so on. Over to you.
Absolutely. Let me also bring in Dr. Swati Maheshwari. Dr. Swati Maheshwari, your advice, ma'am, to the people who are watching as now India records over 1,000 active cases of COVID.
See, first of all, since the time corona, started spreading to humans, it is very much there and it hasn't got wiped out yet. So every time corona manages to, the variants that are there, they manage to have a substantial amount of mutation, we see a surge. And this is kind of an yearly phenomena for us that, every time a new variant which has, the power to break through our immunity comes up, we see suddenly a surge in the cases, and that is what is happening right now as well, because our immunity over the time wanes off, and that's why, till the time this virus circulates around, till the time people, start getting these subclinical infections and start building up their immunity against this variant, we might see a surge of such cases as we are seeing right now. I think 2-3 more very important things over here. One, definitely, as Dr. Sanjeev also said, that we don't need to press a panic button as of now. So anybody who's having flu-like symptoms, they should, be in touch with their doctor. they should stay at home. They should manage, they should, actually proper hygiene should be followed. They should use the mask. They should isolate themselves for a while. But in case after 3 or 4 days, if you feel that your fever is not coming down, you're not able to take orally well, or your condition is deteriorating, then is the time that you should do your COVID test and see whether you're suffering from COVID or not. But you should start your isolation, and at least you should start hygiene practices before you actually test COVID positive, because we already know these things. Now, since we've already burned our hands with COVID, the government gets very active, and that is what we are seeing right now. That everywhere preparations are being done. The hospitals are being advised to keep beds, to keep their oxygen placed, but this is nothing to make people panic. This is something that, we are already trying to be in place. We are trying to be ready in case any eventuality happens, and that is what the government is doing. So this is not something that should worry people or make people panic about it. Thirdly, I would say, see, all those who have taken COVID vaccine or boosters should not go and rush and get now another booster, thinking that since the surge is happening, we should go and take the booster. No, definitely booster is not required for each and everyone. But a certain section of society who are already transplant patients, cancer patients, or suffering from long-term illnesses, these are the ones who can go and take a booster vaccine if they want, especially if in their area where we are seeing a surge or uptick of cases. So these are the ones who can go and take. And even if you have taken Covishield or Covaxin, irrespective of the fact which vaccine you have taken, you can still take a booster dose of any other heterologous vaccine. So you can go and take Corbevax, you can take Corbevax, you can take Covishield, you can take Covaxin, any of these vaccines. But again, I'm reiterating the fact that it is only for certain sections of the society or people who are at high risk. Now, everybody should not go and rush and get a booster dose, which is not required. Everybody should not go and rush and get the COVID test, that is also not required. So nothing to worry as of now, things are under control. And we every time see this surge whenever a new variant comes up.
Okay, Dr. D.K. Gupta, bringing into the conversation, sir. Dr. Gupta, I want to understand from your perspective, advice specifically for small children as well as the elderly, sir. What is it, any protocol that people with small children in the house or the elderly need to be following at this point in time?
I think current COVID surge is definitely for concern, but we need not to be panic also for children also. Definitely we know that children has good immune power against COVID. In this last COVID wave we have seen that also. But currently India has more than 1,000 COVID cases. Out of that around 750 are new, and more than 100 active cases are right now in Delhi and NCR also. It means I think we have to be more cautious, especially about the pregnant ladies and the small children also. If we see children less than 5 years, their immunity is quite low and they can develop sometimes complications, especially those children who are having sickle cell anemia, or having thalassemia, who are having congenital heart disease, pneumonia or asthma, or sometimes suffering from liver diseases, kidney disease, on dialysis or immunocompromised state, having on steroids. So these children who are less than 5 or suffering from these comorbidities, they should have been or more precaution. They should be given more precaution if they are having any symptoms of fever, cough, cold, that is known as influenza-like illness. If they are having more than 3-4 days and it is not responding to normal treatment, definitely they should consult with their local doctor. Also, if there are some alarming symptoms, like if child is having high-grade fever, not responding to medicines, and continuously running high-grade fever, is having respiratory distress, breathing difficulty, chest pain, his lips or fingers becoming blue, or he having loss of consciousness, seizures, or refusal to feed, apathetic or weak, or very no appetite, or poor feeding, or irritable, lethargic, these symptoms may be some signs of serious concerns. If these symptoms are your child is having, or any child is having, I think he needs immediate hospital consultation. Maybe he needs admission also, and may require some tests like X-ray or blood counts and some other tests also, so that according to that like severity of illness, treatment can be given. Definitely I will let you know, like we can support children with other vaccines also, not COVID vaccines. Definitely we have some other pneumonia and flu-like vaccines, also like influenza vaccine is there, Hib vaccine is there, pneumococcal vaccine there. I will suggest all the parents, they should give all these vaccines. Those are available in the market, in the government setup also, in private setup also. These vaccines will prevent, definitely will not protect against directly COVID, but they will prevent from cross infections, and they will also prevent from the complications of pneumonia and other diseases. So So I think we should work on this, and definitely pregnant ladies, they can, if have the COVID, they can develop pre-labor pains also, premature delivery also, and complications in the neonate who is born. It can have infections, septicemia, jaundice, and respiratory distress. These complications can occur for neonatal who was delivered from a pregnant lady. So therefore, pregnant ladies also should have precautions before going out in a very crowded place, or they should wear masks, or they should stay inside. They should have proper sleep, proper hydration, and all the antioxidants and medicine advised by their doctors, especially those patients who are suffering from diabetes, hypertension, asthma, and other illnesses. They should definitely have precaution, either being a children or adult or any age group. These are comorbid patients. They are very vulnerable, and they can develop severe illness if they have COVID, or they can develop complication and have death also. These group of children, these group of adults who are suffering comorbidities, they should especially have precautions and stay out. Also, I think that also Dr. Swati Masri and Sanjeev Bagai told on that, but definitely I think we should, as India, Indian government and healthcare agencies, work on the COVID vaccines also on current variant available in the space. Not the previous vaccines. They will not be very effective in current scenario, and we require definitely vaccination for all these vulnerable groups and in first line like healthcare professionals and other administrative people who are first line volunteers or first line of our society. These should be vaccinated for the current strain. So we should have some strategy and policy, because this is recurring for last 5-6 years. We are watching it every year.
Interesting point there. I just have a couple of minutes left. Dr. Bagai, I just want to get your perspective on the same as well. New mothers, as well as about the vaccination aspect of it, booster shots, flu shots, your advice, sir?
Okay, so in terms of COVID vaccine, I want to make it absolutely clear, this is worldwide published data for more than about meta-analysis of 500 peer-reviewed studies. The previous vaccines which were made on the viral strain, which is the initial part of the alpha strain, don't have adequate protection for Omicron, especially the XBB, what we are seeing now, and the JN type 1 and XDV, which we are seeing now as NB 1.8.1. They don't have adequate protection. So to continue to give vaccines of the old strain is inadequate. What is required is definitely for the people who are vulnerable, we can give the influenza and the pneumococcal. The best method to prevent COVID is wear a mask.
Okay, all right. On that note, I thank all of our guests for joining us on the broadcast to take us through their important advice there, viewers. Of course, all doctors, they're clearly maintaining there is no need to panic, but let's take some basic hygienic precautions to keep ourselves and our loved ones safe. On that note, a very short break.